Hi everybody, my name is Jenna. I'm a yoga instructor and I'm here today to talk a little bit about the breath, the mechanics of breathing and how we use this entire intricate system of our breathing apparatus in order to support the breath so it can flow freely and easily. So the diaphragm under the rib cage, as well as the pelvic floor muscles, have to work in conjunction with the abdominal muscles in order for us to take that full deep breath. So here's a little anatomy lesson for you. When you take a full deep inhale and the breath is functioning properly, the diaphragm underneath the base of the rib cage is going to contract downward. And consequently, that's going to push on our internal organs, which will also move downward. And as a result, the pelvic floor will also move downward. And on the exhale, the pelvic floor will contract slightly to move back up. The organs will move back into place and the diaphragm will relax at the base of the rib cage, coming to flatten out again. So essentially, our pelvic floor is getting a little bit of exercise on that movement to support the breath. So the abdominal muscles also play a very key role in supporting the breath as well, especially the transverse abdominis, which is the deepest layer of our abdominal muscle. So the transverse abdominis essentially works like a corset. The fibers run sideways around the body and it inserts into the low rib cage. So when the transverse abdominis contracts, it moves inward. You can think of it like tightening a corset or maybe tightening a notch on your belt. And that action serves as a key support of the exhale. So we need that motion to support our exhale as it moves out. So if we have poor posture, our transverse abdominis are going to be weak. So think about it. If you have rounded shoulders, if you have a closed off chest, we know it makes it very difficult to take that full deep breath, right? And as a consequence, that pelvic floor is not getting that exercise, that movement of stretching down and gently contracting back up. And the transverse abdominis is not getting that exercise of that contraction being used to support the exhale. So are you getting it? It's all connected, right? And so what does all of this mean? Well, we can look at this very simple breathing exercise so we can start to integrate all of these things and create some awareness and practice using all these things so we can finally take that full deep breath. So we're going to go through a simple breathing exercise, and the purpose of this exercise is so we can start to explore how to properly utilize all of those respiratory muscles in order to support that full deep breath. Now, to start this exercise, when we're first learning how to breathe, it might be better to lay on the floor for this. And that's because we can have the support of the floor, the support of the earth, and we don't have to put any extra strain on the back muscles, and we can keep the chest nice and open. So we'll come to lay on the back here. And just keeping a natural curve of the spine, natural curve of the lumbar spine at the low back. We might walk the feet to the outer edge of the mat and just let the knees fall into rest on one another in order to take any additional pressure off the low back. And from here, we're going to bring one hand to the upper chest and one hand comes onto the low belly. You might use a blanket, a folded up blanket or something under the head for a little additional comfort as well. If that feels better in this position. And if it feels comfortable to close the eyes here, so you can start thinking about that breath internally, you can do that. Or maybe just finding a very soft, gentle, fixed gaze to start here. And then from here, from this place of stillness, just coming to the breath. And without trying to change or manipulate the breath right away. So just letting the breath move as it wants to. And trying to see here if we can make a few observations about the breath without changing. So noticing the length of the inhales and exhales. Maybe one is longer than the other. Noticing if you have the tendency to have any gaps or pauses in the breath. And also starting to notice here where the breath wants to travel more readily in the body. So maybe it wants to travel more into the upper chest. Maybe there's some movement of the belly. Wherever it is, just taking that observation. Also scanning the body to notice any areas of tension. seeing where we can soften a little bit. So that might be softening the face, letting the forehead relax, maybe bringing the tongue to the back of the teeth and letting the bottom half of the jaw hang heavy. And then from here, from this starting point, now we'll start to slowly control the breath. We'll start to slow down the inhale through the nose and starting to smooth out and lengthen the exhale. Maybe the exhale moves through the mouth. Seeing if we can get rid of any gaps and pauses here. And then from here, as you continue to smooth out the breath, taking that full deep inhale, thinking about the breath expanding into the upper chest, expanding into the rib cage, down into the belly, and just letting the belly move freely here, relaxing as if you're filling up a balloon, and those pelvic floor muscles gently relax downward. And then on that long extended exhale, that gentle contraction as the navel moves towards the spine, the rib cage moves in and the chest will lower. Staying with this pattern, inhaling into the upper chest, expanding through the rib cage down into the belly, and exhaling to soften. The belly lowers, the rib cage moves in and the chest moves back down. And from here, maybe you start to lengthen the exhale even a little bit more than the inhale. And you might add that slight restriction to the back of the throat. They call it our ujjayi breath sometimes in yoga. A good image for that, though, is just fogging up a mirror. There might be a slight hissing sound. And you'll stay with this slow, smooth breath here for maybe about 3 to 5 minutes or whatever your comfort level is, really thinking about sending the breath into all of these places. And when you feel done with that breath, you can just bring the hands to rest along the side of the body, maybe face up or face down, whatever feels more comfortable. And then once again, just returning to your normal breath. But maybe it's a little slower, a little smoother, and a little more activated in some of those areas that were stuck before. And from here, we have that very base level of starting to take that full deep breath.